Hello, Sat Shri Akal. This is Navjeet Kaur. Today I am going to discuss about some anti-arrhythmic drug. So as you all know, we have four chambers of our heart. Two are atriums and two are ventricles. People have problems either with atria or with ventricles, so we have to treat appropriately depending upon which of the chambers are getting affected. So clients who are having problems like atrial fibrillation means the heart rate is getting too fast, atrial tachycardia, atrial flutter or bradycardia. We used to treat those patients with the drugs A, B, C, D. Here A stands for atropine and adenosine. Atropine is a drug that we used to administer for clients with atrial bradycardia because it increases the heart rate. Another type of drugs used to treat dysrhythmia includes beta blockers and calcium channel blockers. Beta blockers and calcium channel blockers, they both are antihypertensive drugs. Beta blockers are the drugs that ends with lol, such as atenolol, metoprolol, propanolol. These are also used for treating atrial dysrhythmia, as these drugs also decreases the heart rate of the patient. They are used to treat tachycardia, atrial fibrillation. Next type of drugs are calcium channel blockers. These are the drugs ending with the dipin. They are also antihypertensive drugs. They both decreases the heart rate. So keep in mind, if your client is suffering from atrial bradycardia, so you are not supposed to administer any of these drugs to your client. Which type of drug is digoxin? Digoxin digs for deeper contraction as it increases the force of contraction. However, this decreases the frequency of contractions, means it will decrease the heart rate but it will increase the contraction intensity. So this drug is used to increase the cardiac output in clients who are having weak contractions. These are the drugs to treat atrial dysrhythmia. Next drugs are for ventricular dysrhythmia. Ventricular dysrhythmia includes ventricular tachycardia, ventricular fibrillation. So for ventricular problem, the drugs we use are LAP. L stands for lidocaine, A stands for amiodarone, and P stands for proponamide. All these drugs we use to administer to clients who are having ventricular dysrhythmia. Ventricular dysrhythmia could be life-threatening. We have to carefully monitor and closely monitor our client for signs of shock and for blood pressure drop. You need to carefully monitor. So I hope you like this video and you get to learn about some anti-dysrhythmic drug. Thank you and keep watching my video. You can also join my online coaching classes if you want to crack your NCLEX.